kind of unusual because the last ADME was in Hong Kong and we had a great time. I enjoy it. Now it's a bit different, you know, things have changed. And maybe I start with this cartoon that tells us how things have changed. Remember in the old days, you go to a bank and you wear a mask and you call security. Now, if you go to a bank and don't wear a mask, they call security. So things have really changed. But anyway, today my talk is really quite unusual. It is WHO's role in infection prevention and control. Now, I'm sure because of the recent declaration of, we call FIET, which I will discuss later, Public Health Emergency of International Concern, we are very familiar with infection control linked to WHO. Now, there are 5 ways we often link with WHO, and WHO has a role really in infection control. And there are 5 ways. I will talk about these 5 ways. And of course, as I said, the most recent one is linked to FIET, which I will discuss more. Okay. Now, first look at this. This is the International Health Regulation 205, way back, that sort of discuss and talk about WHO and what do they do in terms of international health. Now, if you look at this book, it's still on the website. It is June 2007. You can download it if you're interested. As you can see, there are 4 big areas: global partnership, strengthening national capacity, prevent and respond to international public health emergencies, and legal issues and monitoring. Now, if you look at this table, you can find that really, as I put down here, infection prevention and control is only a small part of WHO's work. So do realize that. Now, of course, I am right now talking about hospital infection control more, okay? So as far as hospital infection control, WHO work is really only a small part is linked to it, and I put it in red. Now, so under strengthen national capacity, it says there, strengthening national diseases, prevention, surveillance, and control. You will note quite soon that as we talk about WHO work, it's always linked to surveillance, control, and so on, not just pure infection control. But there you are here, number 2, areas of work. Number 2 is prevention, surveillance, and control. Now, then look at number 5. This is the next big part, which is national management of risk linked to a whole list of diseases: influenza, meningitis, yellow fever, and so on. And so in this document, these are the 2 main black and white, or underlined by red by me, where it's really written down and linked to reducing the risk of doing infection control. Now, but please note in this table, there's so much other work: global partnership, legal issues. So do keep in mind that when you look at WHO, they have a whole big part to do, and infection control is just a small niche, but still, of course, important. Now, there are 5 ways. I've been working with WHO, link up in many ways, but there are 5 main ways which I will touch on very quickly today. Now, first, so this is a topic. Now, first is linked to specific diseases. In fact, way back when I first link up with WHO work, it is with specific disease. Polio is one of them. In fact, I was much involved in the drive to end polio. But TB is another one. And this document that I show you is 2009. As I understand, it's still up in the website of WHO. And it says here, WHO policy on TB infection control. See that, huh? Oh, sorry. Infection control, as you can see, in healthcare facilities. So here you are, there you are. It's linked to specific diseases and is really focused on hospitals, healthcare centers. So one way is linked to is specific diseases. And if you are involved in certain specific infection control diseases and want to do infection control, often WHO will have some kind of committee around and you can source it and see if you can get involved. Now, the second one is linked to other WHO program. Now, these are more in the past. Later on, I will touch on definite departments in WHO. So in the past, there are no clear departments. It's more to the diseases than to programs. Now, this is a very well-known program, as you know, the hand hygiene program. But if you are involved and familiar with it, it is called Patient Safety Challenge. In fact, this is the first Patient Safety Challenge. So there you are. It is linked to WHO program, and it is called Patient Safety. Now, I was in fact involved in the core group. This was the core group, and we designed the whole guidelines. And therefore, if you are involved in some kind of especially safety program or other programs, you can work it out and see if we can tie up with some of the programs that are going on. Now, in fact, the first Patient Safety Challenge, it was started in 2005, years ago. And this was that part where it links to Hong Kong, as you can see, on direct TV link. And we are so happy. Now, all this is history now. You know that the first Patient Safety Challenge, hand hygiene, is still sort of very active, still going on. Okay, now, in fact, the third Patient Safety Challenge. Now, the first Patient Safety Challenge is hand hygiene. The second is safe surgery. So in the second Patient Safety Challenge, it was sort of not very much involved with infection control. Then we come to the third Patient Safety Challenge, and it was antimicrobial resistance. All right, so as you can see in this table here, antimicrobial resistance. This is the book. So we were called together, and as you can see, this is the document they put up way back. And chapter 5, there you are, infection prevention and control. All right. Now, in the midst of the third Patient Safety Challenge, something happened. Antimicrobial resistance becomes such a big concern that WHO promoted it to not just one area, not just patient safety. And now they say antimicrobial resistance. In fact, I still remember it was announced, and the Director General announced saying that there are two big concerns affecting man. One is weather change, climate change, and the other is antimicrobial resistance. So obviously, as doctors, we should focus on antimicrobial resistance. And so they sort of promote the whole thing. The third Patient Safety Challenge is then promoted to something that the whole WHO need to be involved in. And there you are. So the first thing they did in 2011 was to push it such that the World Health Day is totally focused on antimicrobial resistance. I still remember all these posters came up, and then we came up with this book a bit later. And it was sort of, we meet and make all this, and then it was promoted, but we still came up with this book. But it was sort of no more the whole WHO. This is just still patient safety, and it has been promoted to the whole WHO. Now, when the whole WHO took it up, there were many other activities. And then, as Dr. Chen, who was then the Director General, by the way, you know Dr. Chen, she is from Hong Kong, so we were very much involved. And as he says, AMR is now a serious problem. As put on the top here, AMR, a problem so serious that it threatens the achievement of modern medicine. Big, serious problem. Now, the WHO pushed it up, and it says that the solution is a One Health approach. And so it's no more just patient safety. It's pushed up to One Health approach. And One Health means, as you can see in this diagram, it involves animals, environment, and human. So it's now sort of more global, more broad, and there are many officials program involved, as you can see here. World Health Antibiotic Awareness Week, and so on, many others. Now, the thing that we were really involved in, if you are in the hospitals, is this thing called GLASS, or the Global Antimicrobial Resistance Surveillance System, all right? And this is still going on. I will touch on it a bit more, but there you are. Part of the GLASS program is involved infection control. But then there are others too. GARP, which is research, and then the UN, in fact, have a committee. They call it Intra-Agency Coordinating Group. So all this together is involved in AMR. Now, as I said, so as the second thing, first is to specific disease, then to specific programs. But the programs can be enlarged and promoted right in the middle of it and become even bigger, or it may suddenly stop, you see. But for AMR, it becomes really a global thing. The whole WHO involved and it's still going on. Okay. Now, then the third way we get involved, and this is more solid, is the WHO begin to get departments to start doing it. So my first involvement in a definite department where we are linked up is these guidelines, in which it is called Infection Prevention and Control Epidemic and Pandemic Acute Respiratory Disease. For short, we call it ARD. Okay, I'm sure you heard of it. ARD, Acute Respiratory Diseases. Now, I'm sure you are familiar with this guideline. Many of us, I'm sure Brenda, you get involved in this too. But just to note that it is run by a department. Now, that is, of course, the whole region, Western Pacific, but it's and the Department of Epidemic and Pandemic Alert and Response at WHO headquarters. So this is the third way in which WHO link up infection control. They get a department, and then they think that ARD is very important and need a guideline, and so they started this guideline. Now, so in fact, we work on this guideline. They call it non-pharmacological aspect of infection prevention and control. There you are, infection prevention and control. Is linked to a specific group of diseases, but now it is done by a definite department. And then the whole bunch of experts is gathered together, as you can see here. Now, in fact, I'm sure you know many of these names, you know, and Michael Bell from the United States and so on. It's years ago now. And as you can see, at that time, the person who runs the department was Carmen. So I and Carmen were the co-editors. All right. And we had lots of hours together working on this we call it interim guidelines. Now that was June 2007. Wow, it's years ago. I almost can't remember now, but it's 2007. Now then the WHO finally later on upgraded to a definite guideline, 2014. Okay, but it's still under Carmen in that department I told you about. Okay. Now just also to move on, is still within the department. At that time, again under the same department, we work out the core components. And again, it's long time ago, you know, it's as you can see here, is 2008 or 2008, sorry, huh? And it's way back where we were asked to figure out what were the core components, the important ingredients that make hospital-acquired infection control important. What are the core components? What must we do? So we work out this timetable at a time. Now notes, as you can see here, is again under the Department of Epidemic and Pandemic Alert and Response at WHO headquarters. See? So again, we're still on the third way in which a certain department in WHO is asked to be responsible for certain activities. So sometimes when you are doing certain things and you want to know, you need to find out which departments is involved and then sort of link up with the department. But this is the third way, it's a definite department. Now we did something, yes, this guideline core component will later on upgrade to a definite guideline in 2016. I will talk about it a bit later, but it started way back in 2008. It was then sort of just a report, interim, and now it is upgraded to a definite guideline. I will talk about this quite soon, all right? Just keep this in mind. It is now upgraded to a definite guideline. Now, we also did something under the department, under Carmen and others. We also work out a guidance in healthcare setting on natural ventilation. And in fact, we met in Geneva, but we also have 1 or 2 meetings right here in Hong Kong, work out everything. And this is still on the website. You can download it at the WHO website. Okay, now, just to show you this book, it's called WHO Handbook for Guideline Development. Again, it's on the website, you can download it. Now, why do I show this? Well, because as you can see, now take a look at this, the ARD. It is interim guidelines. Then it's upgraded to guidelines. If you take a look at this, this is just a report, core component. Then it's upgraded to guidelines. Now, there are committees that will decide whether you have reached the status of guidelines yet or not. But one big thing is this handbook. Before WHO now calls anything a real guideline, they have to go through and get and pass this level of evidence. We call it the WHO grade approach. And if you're not familiar with it, therefore, if you want something, you want to be involved in some guideline production. If not, it's not called a guideline. At best, it may be called an interim guideline. But the full guideline need to accomplish what we call the grade approach. Now, of course, I can spend hours on this, but just to let you know that the WHO will go through all the evidence that is published. They call what they do what they call a systematic review. And as you can see here, those studies that have controls will reach a high level. The moment you have no controls, it is pushed down to a low level. So it's pretty strict. So whenever you look at a real WHO guideline now, they will tell you what is the level of evidence. And the whole level is built on grade. In fact, they often would sort of contract this out to a university to do the systematic review. And then you have to do all the work. For those who have done it before, like me, you know what it involves. We go through the computers, get all the studies, and then reach an agreed level of evidence. Now, then based on the level of evidence, we decide on the recommendations. The recommendations can be strong, as you can see here, strong, or weak. Now, who decides? Well, there is a group, they call it the GDG, the Guideline Development Group. And for many of you here listening, I'm sure some of you are involved before in what we call GDG. And it's just Guideline Development Group. So often in the past, we'll go to Geneva, usually. We sit down and then we go through all these factors and then decide whether it should be a strong recommendation or weak recommendation, or often no recommendation, or moderate, middle of the ground recommendation. So as you can see, quite a lot of work, but it's often spearheaded or supported by a department from the WHO. Okay. Now, under the WHO, and only recently, 2016, they form a unit. In fact, Benedicta, who runs this unit, is still running it. They call it the new WHO Infection Prevention and Control Global Unit. All right. It's still there. And in fact, because of the recent pandemic, the unit get very active, very much involved. Okay. Now, so take a look. This was the original. When the unit was first formed, it was very much AMR. You see? So AMR, Global National Concern, this is sort of the big thing, you see? Now, AMR, Global Concern. And then, of course, other things, outbreaks, international health regulation. In those days, Ebola is very important. Universal health coverage, patient and health worker development, and WHO global strategy. Now, I show you this table purely to emphasize to you. Now, take a look. Yes, there's infection control, but it's only form a small part. So you need to understand where infection control plays, and you want to do something linked to it, you need to work it out, how to be connected. But there is now, as I said, this unit, WHO Infection Prevention and Control Global Unit, that often takes up a lot of the work of pure infection prevention and control linked to WHO. Okay. Now, at that time, in fact, as you can see, there are many things they do. And number 3, we just underline it. See, again, it is very much AMR, but you can see here, reduce the incidence of infection through effective sanitation, hygiene, and infection prevention measures. Again, see, the very WHO. See, you have sanitation, we got it wash now, sanitation, cleaning, and all this is all integrated together. So you must understand how WHO works out for infection control. Okay, now I told you, with Benedicta, he upgraded the whole guidelines on core components. Okay, it's now an official WHO guideline with systematic review all done. But under the Infection Control Unit, there are also many other guidelines produced, including, as you can see here, SSI, surgical site infection, okay, decontamination and sterilization, injections, and so on and so on. And I'm sure more will be coming out. And of course, with the present pandemic, many have already been produced. Okay, now, the fourth way. The fourth way is networks. So if you are interested, there is this thing called GIPCN. It's very much a Global Infection Prevention and Control Network. GIPCN, Global Infection Prevention Control Network. I don't know why, but it's pronounced gypsy. So don't, I've heard WHO people call it CPAN. No, it's not CPAN, it's gypsy. We sit down in the meeting, we call it gypsy. And there are all these things linked to the network. Now we are linked to this is where I am, WHO Collaborating Center for Infectious Disease Epidemics. That's I'm the director of this center. And of course, it's under China. So there you are. So all this is linked and is through network. There are many other networks too. COHAN, very important. Global Outbreak Alert and Response Network. They are responsible not for outbreaks. In fact, there is 250 technical institute. They call it GOHAN. And now Singapore is very familiar with this because Dale Fisher is in the steering committee. I don't know if Dale is listening in, but Dale, I mentioned your name. Brenda, let him know. Okay. All right. But in fact, in some of our gypsy meetings, Dale sometimes appear, of course, representing GOHAN. Now, another very well-known network, which is now still active, is AMR Collaborating Center Network, okay? And there used to be just 14, but there are more now. It's still active. And in fact, quite soon, we will have a meeting towards the end of the year, maybe the start of next year. Again, we couldn't meet. We used to meet, somewhere in the world. And in fact, this is our collaborating center, again in China. CHN, they have a code. This is ours, all right? So again, the fourth way is, two collaborating centers. Now, we do meet, once a year at least. And this was it. This was in Cairo. The last time we meet, 2019. Can you believe that? Now, I was there. Just in case you don't see me, I put this big arrow. See, that's me. Okay. Anyway, I'm sure it's not important, but I just put the arrow, maybe just as a joke. Okay. Now, number 5, the most important. Suddenly, I think everyone knows about this. In fact, previously, some know, some don't. We call it PHEIC, Public Health Emergency or Infection Control. Now, what is this? Well, I used to give talks all over. Understanding, we call PHEIC. Now, PHEIC stands for Public Health Emergency of International Concern. Okay? Now, I put my little qualifications in talking about this is because the first one was H1N1, 2009. And to have a PHEIC, you need to form an emergency committee. So really, I was quite privileged. I was involved in the first ever emergency committee ever formed. So I sort of know the whole thing. But to be honest, most of our interactions, even at the time, was through the telephone. And because I was in Hong Kong, I have to really talk so many hours in the middle of the night. Not very comfortable. But the same, even today, many of the meetings you have for COVID-19 is all, through Zoom, and in Hong Kong, we have to do it late at night. Okay. Now, in fact, Keiji Fukuda, who used to be the former assistant DG, this is what he says. Now, of course, this is just a legal thing, but Keiji Fukuda tells me it's pronounced Fiat. So let's know that. Previously, Fiat was a car to me. But in case you want to go to WHO Geneva and people know what you're talking about, just know they pronounce it Fiat, PHEIC. Previously, to me, Fiat is a car and, nice models, and that's how, but now it is the Public Health Emergency or Infection Control. Anyway, again, just a light note. Don't take me too seriously. Now, so let's look at Fiat. It is an extraordinary event which is determined to constitute a public health risk to other states through the international spread of disease and to potentially require a coordinated international response, right? So it's quite serious. And in fact, they are given, there's an article of law that gives WHO the right to do this. And 3 fundamental criteria must be fulfilled. Number 1, it is an extraordinary public health event and is risk to other states, and you need an international coordination to handle it. Then we decide. And the WHO also should be notified. This is in fact in their law books in any of 2 of the 4. Now, I wouldn't go through in detail. Like if you feel that there's a public health impact, you should let WHO know about it. Okay, now, so according to KG, it's not easy. When it's made known to WHO, information often is not sufficient. So it's not that easy to decide whether it's a Fiat or not. And it's not easy also to identify that whether international collaboration is needed. It's also not easy because it will spark off. Once you say it's a Fiat, wow, the whole world get panicked. And the fear can even cause adverse effects. So it's not an easy decision. But still, of course, once you declare it, there's international collaboration and communication between hospitals within the country will be easier. We get into action. And of course, it's easier to get the government to relieve resources. So it's not that easy. You have to decide, okay? Now, altogether, there are 6 Fiat decided so far. As I told you, the first one was the flu, and I was involved in it. Now, all these 6 of them, the others are over. Only 2 are left still active. One is polio, and I really updated it. It's still active. In fact, the polio is spreading apparently in Pakistan and Afghanistan, or partly due to the war, of course. But it's still ongoing. It's still a Fiat. It's not declared over yet. And the next one, of course, you and I know. In fact, the 9th meeting just took place, and the 9th meeting declared that COVID-19 is still a Fiat and going on. Okay, so this is the summary. All right. Now, what can we in infection control appreciate? If there's Fiat, high risk of international spread, so be very careful. Now, number 2 is good to note. When there's a Fiat, the WHO will act straight away to produce guidelines, often infection control guidelines. So the moment Fiat is declared, go to the website. Like for instance, in H1N1, we produce this the day after. Once it's declared Fiat, the day after, we come up with the guidelines. All right. Now, what about COVID-19? COVID-19, once it's declared, do you know that right now on the website, there are over 100 WHO guidelines on money, on how to meet it, on media, everything. Wow, it wasn't like that before. We used to only have a few guidelines, 100. Now, how about infection control? Infection control, in fact, has, as I put here, the chart is blocking me, I think it's 15. Am I correct? Because my chart is blocked by this. Yes, 15, that's right, okay? There are 15 guidelines. It's all on the website. You can download it. And I tell you, to do this, we have what we call the GDG. And we all met and talk, and some of you are involved too in Singapore. And anyway, we come up with all these guidelines that are on the website. All right. So it's very useful. Hopefully, it really helps the world. Now, in Hong Kong, I just wanted to pass a note. In Hong Kong, we did pretty well for COVID-19. Now, no time to go into this, but in Hong Kong, we only have 12,000 cases, and now we have close to 70 days, no new local infection. I can go on and on, but just to let you know, the 2 big secrets of Hong Kong is that we have no home quarantine or home isolation. No, let me repeat. We don't put any patient at home or quarantine. Now, we have thousands of isolation beds because of our SARS experience, and also lots of large quarantine centers. So the moment you are diagnosed, we do contact tracing, and you don't stay at home. In Hong Kong, it is definite isolation and definite quarantine. And that is basically our secret. Now, so why What if it's declared fiat and the disease still spread? Well, usually it's because bad infection control. Give you some example. Now, this is Ebola, okay? And this is the famous hero. But you see all this, you see the outside mask, they wear it such that it's tied outside. That's wrong. The WHO has a guideline. It must be inside the head cover. Got it? See, inside the head cover. It's not done that in the Ebola outbreak. See, inside the head cover. And then, wow, take a look at this. This was in another outbreak. But you see, are you impressed? Wow. And then what is this guy doing here? You see? Now, there are all these kinds of errors in infection control that leads to the disease spreading. But anyway, if after fiat is declared and the risk remains low, also keep in mind, if the risk remains low after fiat is declared, it can be a WHO overreaction. So the biggest example is Zika. Now I have no time because time is running, so I will quickly go through the slides. Now for Zika is really an overreaction. Yes, it started in Africa. And when it was declared, because it was the Olympic Games in Brazil, so 2015 it was declared. But in fact, it has spread to Malaysia and Singapore and our Asian. 2007, it was in Micronesia. So it's nothing new. It says that when it spread to Brazil, there was the Olympic Games and all kinds of hue and cry. And plus in Hong Kong, there was so much hue and cry. And just for your information, yes, Aedes albopictus can spread, but they usually only bite the pigs. Do you know that in Hong Kong, Aedes aegypti, that is the main mosquito. This is the main mosquito that spread Zika. This mosquito dies in our winter. So it doesn't exist in Hong Kong, only at best, maybe in the summer, it came by airplane and leave for maybe 1 to 2 weeks. So it's the alarm. Now, this chart just to show you, it is 3rd of November. I got an update one for today's talk. In fact, as I say here, later on, they published category 2, area in which there's evidence of virus circulating even before 2015. See, even before 2015 was already circulating. And they put some countries, as you can see here, Malaysia, see, it's our part of the world, Philippines. So it's already going on way back. And it's just an overreaction because of the Olympic Games. And so they declare over quite soon, November, and then they put it on to a research protocol. All right, that's how it's usually done. Once it's over, they put it onto a research protocol. Okay, now there you are. There are 6 fiat declared so far. But the moment a fiat is declared, for us in infection control, the most important point is that guidelines will be available. So go to the website and get it. Okay. Now, what if you hear so much about some disease and it's not declared a fiat? You know, you hear, wow, this and that, and how come it's not declared a fiat? Well, the big reason is this example. MERS, never declared. And I can quote many people why it should not be declared, but I might as well quote KG. You know, KG in fact says they went to investigate Korea, and he says here, WHO does not advise it being fiat, and I put that in red. The 5th meeting of emergency committee that there is no evidence of sustained human-to-human transmission. So that is the key. Yes, there may be an outbreak here and there, but if there is no evidence of human-to-human transmission, then it should not be a fiat because it will cause a lot of alarm and unnecessary worry. All right. So the key thing is really human-to-human, sustained human-to-human transmission. All right. Okay. Now, very quickly. So what is the WHO role to IPC? As I said, usually a small part, but it's linked to some specific disease like TB, polio, programs like patient safety for hand hygiene, some departments and unit, and today now we have an IPC unit. It's not a department yet, it's the unit, and it's still going on. Now then there are networks that do infection control, and of course the most clear black and white one is, we call it GIPC, GIPCN. And of course, most recent is anytime is declared fiat, then there will be infection control net guidelines that will be in the website. All right. Now I think that's it. And as you know, I'm in Hong Kong, so do come take a look. It's a beautiful city in spite of COVID-19. So see you here. Thank you.